welcome Dr. Deshmukh, who will present time below range and its link to impaired awareness of hypoglycemia and severe hypoglycemia, evidence from the Association of British Clinical Diabetologists study.
So thanks for inviting me here for presenting this data. So I'm going to present some data on time below range and its link with severe hypoglycemia and impaired awareness of hypoglycemia. So these are some of our disclosures. So there's a backstory here. This was 2019, and the adoption of CGM across the UK was only 10.7%. As you might be aware, UK has NHS, which is free point-of-care healthcare. And if you want to implement a new technology or new treatment, we have to prove that it really works. So to help the assessment of the CGM across the UK, in 2019, national audit was started across 107 hospitals in the UK, and the clinicians who were using CGM were invited to add the data on the national NHS platform, after which it could be analyzed. So this was a very, very successful audit, and several papers came out of this. We showed that use of CGM in the large population-based study was associated with improved glycemic control. We showed that CGM will reduce your diabetes distress. We showed it improves impaired awareness of hypoglycemia. We also showed that the concern that technology might not be useful in older adults is not true, and CGM was equally effective in older adults with type 1 diabetes. We showed that there were large-scale ethnic disparities in CGM use across UK, and we also showed that some of the benefits of the CGM could be because of improved time in range. So things have changed now. So this year, more than 90% of people living with type 1 diabetes have access to CGM, and recently I was told it's about 99%. So that's very good. So the use of CGM has increased significantly, but now we need to understand some of the matrices which are associated with CGM. So there are several matrices, and one of them is time below range. So it's very commonly used, and the international consensus says that the time below range should be less than 4%. You all use this, but there is very limited data on the association of this matrix with severe hypoglycemia and impaired awareness of hypoglycemia. So for example, if a person with diabetes consistently has time below range of less than 4%, what are the implications for their driving? Would you be worried that they are at the risk of having severe hypoglycemia? Would you start reducing their insulin significantly because their time below range is less than 4%? So these are the answers. I think there are not many, these are the questions for which there are not many answers. So the objective of this study was to precisely understand this. Is there a link between time below range, severe hypoglycemia, and impaired hypoglycemia? So we used the data from the National Association of British Clinical Diabetologists audit for this study. We used the means, median, standard deviations for the descriptive analysis. We use logistic regression analysis to identify the independent effect of time below range on severe hypoglycemia and impaired awareness of hypoglycemia. And we used a Jordan's J index to identify the optimal cutoffs. So as I said, the optimal cutoffs are based on the consensus guideline. So we wanted to calculate the J index to understand whether it agrees with the consensus. So the Jordan's J index will maximize the sensitivity and specificity and give you a cutoff value. So let's look at the results. So there were about 5,000 individuals for whom we had data on time below range. So you can quickly see that there are only 42% people in the study population who achieved or who had the time below range of less than 4%. And people who did not meet this criteria or had a time below range of more than or equal to 4%, they had a higher duration of type 2 diabetes. They are more likely to use insulin pump. They have a lower baseline HbA1c, and they had higher likelihood of having impaired awareness of hypoglycemia. So sort of some of the things which we can think, which we probably would think intuitively. Then we looked at the effect of time below range on hypoglycemia unawareness and severe hypoglycemia in the logistic regression model. So these models adjusted for age, gender, baseline BMI, and baseline HbA1c. We showed that time below range was significantly associated with both hypoglycemia awareness and severe hypoglycemia. in this population. The significance levels was quite good. However, the effect size was small. So these were the associations. So this is probably the first study looking at this association of time below range and hypoglycemia awareness and severe hypoglycemia. So the next thing we wanted to look was the Jordan's J index. So if we use the cutoff of around 3.35 or 3.95 or around 4, very pretty much similar, the J index shows that the cutoff was 3.35 or 3.95. So it is very similar to what the international consensus says. So this cutoff will give you a maximum sensitivity and specificity to identify impaired awareness of hypoglycemia and severe hypoglycemia. So what does that mean in terms of sensitivity, specificity, positive predictive value, and negative predictive value? So when we use this cutoff, we see that the sensitivity for detecting severe hypo and hypoglycemia unawareness is modest. It's about 73 and 65%. The specificity is quite low, 42 and 43%. Positive predictive value or precision is even lower. But the negative predictive value is very high, 97% and 85%. So what does that mean clinically? So for those of us who don't do statistics, I think that the time below range is like the sensors which you see at the airport. So all of us have gone through it. So these have they have a modest sensitivity. So if you go through it and nothing happens, still they might take you aside and search. They have very, very low predictive value and specificity. So it cannot tell whether you have a key in your pocket or a gun in your pocket. So the predictive value is very low. But the negative predictive value is very high. So if you go through it and nothing happens, very likely that they'll let you through it. So that's the reason why they are used as a screen at the airport. So I think time below range is similar to this. So it can be used as a screen to identify who are at a lower risk for having severe hypoglycemia, right? So what happens? So that was time below range. But what about our old gold score in predicting impaired awareness of hypoglycemia and severe hypoglycemia? So looking at a AUC model. So on your right side is the model which shows time below range and covariates and how good they are in predicting hypoglycemia awareness and severe hypo. So it doesn't do a very good job. It is only about 60%. But when I add gold score to that model, the prediction, the performance of the model actually improves to around 70%. So I think our gold score and time below range can be combined together to have some sort of prediction model for severe hypoglycemia. So the question is, how do we interpret this clinically? So we are still working on that. So to conclude, our findings broadly align with the international consensus recommending a time below range of 4% in people with type 1 diabetes. However, we observed that the cutoffs have very limited discriminatory power in identifying severe hypo and impaired awareness of hypoglycemia, and I think we need more precision medicine here. Time below range, however, has a very high negative predictive value, and it can be used to screen or identify people at low risk for severe hypoglycemia. So I'll thank all the hospitals which participated in the study and happy to take any questions.
We'll go to the back first.
Christophe de Block from Belgium. Thank you for a very nice presentation. I was wondering, did you also analyze whether those time below range occurred in the night versus during the day? Because some of my patients say, okay, I experience no signs of hypo during the night, I don't feel it, but throughout the day, I'm perfectly aware when I'm experiencing hypo.
So we didn't have the data for night and day, but I think something to consider, I think, yes.
To the front.
So I want to thank you for your excellent analysis and some of the provocative conclusions. You'll be aware that the so-called consensus was a bunch of people who consider themselves experts coming to a conclusion, and I was one of those people. So I'm not surprised by what you said. Of course, we know that the number of episodes, symptomatic episodes, can predict severe hypoglycemia, and you should and could have collected those data, because I would be very interested to know whether episodes, we're having this debate at the moment, because percentage below range means absolutely nothing to people with diabetes. whereas the number of episodes that they have to intervene to correct their low glucose is much more important, and of course is also a measure of impaired awareness. So do you have those data? Because I think it would be really important to repeat that analysis.
Yes, so I think, so the question is, can we use number of episodes of severe hypo?
More non-severe.
Non-severe hypo. I don't think we have that data, but I think, yeah, I think studies can look at that. Yeah.
To the back? You, sir. Yeah.
It is me. So thank you. So Mark Evans, Cambridge, UK. So again, beautiful data. So if you mentioned driving then. So if I was to push you and say, okay, so what would your advice be to driving authorities based on this huge data set? How might people change or interpret their regulations? So, and this is not a completely hypothetical question, as Pratik knows.
Yeah, so I think we cannot say yes or no to driving just based on this data. So as I said, it has to be individualized based on overall symptoms. So I think at the moment, time below range, even if it is high, we cannot say if someone can or cannot drive. I don't think we have that data.
I just have one question. So you presented information on individuals. There was a large number of individuals not included in your analysis. Can you tell us about the individuals excluded? I'm trying to think about kind of inference from these results in terms of who wasn't in these.
So this was the data from national audit, and we did not have much control over who included the time below range data. In the paper which we have done, we have looked at the baseline characteristics of those who did not have time below range versus those who have time below range, and there were not very significant differences in the two groups. So I think we are pretty sure that the results are quite generalizable. Yeah.
Thank you.